So why we need OCT in the patients who are having glaucoma? So first of all is that the other investigation which we do, which is the gold standard, is the visual fields, which is more of patient dependent. Okay, so let's say if you have a patient who is old age or who has basically difficulty in doing uh, visual fields, like who has some back issues or who cannot understand the visual field properly. Lot of people are like that. In that cases, visual field not would be not a very good idea to do. And also there is very important thing is 40% of the structural loss is there before the functional loss is there. So that means that a lot of RNFL fibers are already dead before you would get it in the standard visual fields that you do. Okay, so that is why it is important. So the patients can have glaucoma even if their visual field is normal. So that is basically called pre-parametric glaucoma. The next thing you have to remember is that what we use nowadays is the SD-OCT, that is called a spectral domain OCT. So we have two types of OCTs. The earlier ones were the time domain, and now we have the spectral domain OCT. Now, why OCT can pick glaucoma earlier than the visual field? Now, why it is important is that the visual function with the visual field is basically because of the lot of RNFL fibers, and there is a plasticity and overlap inherent in the visual system. So let's say we have 100 RNFL fibers and they make a visual field. Okay, so there are more than 2 RNFL fibers which make the same visual field area. Okay, so even if one is damaged, still the visual field would be okay because there is a inherent overlap. Okay, but if the OCT is there, it can basically detect even if there is a loss of RNFL. Okay, so that's why it is more sensitive for the pre-parametric glaucoma to pick up in a OCT as compared to the visual fields. Now, what is the principle? A visual field can be told as an optical biopsy. Okay, so like a biopsy can show you the various layers of the tissue, a similar OCT can tell you about the various layers of the retina. Now, how it does the work? Because it performs the cross-sectional imaging by measuring the echo time delay and back scattered or the back reflected light from the various tissues. Okay, and how it does it? Remember the word, that is the concept which is called Michelson interferometer. Okay, so what it does is it creates an interference pattern between the light propagating in the sample arm and the light propagating in the reference arm, and then compare it. This is called Michelson interferometer principle. Now, what the OCT does is, the OCT signal from a tissue layer is combination of its reflectivity and absorption and scattering property of the overlying layers. Okay, the intensity of the reflected optical signal is represented on the logarithmic scale with varying degrees of brightness. Okay, so you would see some red colors, some black color, and some yellow colors. So that basically depends upon what is the scattering way. So that depends basically the maximal optical reflection and back scattering, and that basically tells you about the red yellow colors. The minimal signals are represented by the blue black colors. Okay, so these are some important things that you should remember regarding the how the OCT image is basically produced.